This segment of Delmarva Life is brought to you by Peninsula Home Care.
If you need physical therapy, wouldn't it just make sense to incorporate activities that you like to do in the healing process? For instance, let's say you're a puzzler. Well, working with the bones and the movements in your hand would just make sense, right? Well, that's a very general concept in exactly what something called occupational therapy is. With us this afternoon is Megan Keglovich. She is a certified occupational therapist with Peninsula Home Care. Megan, thank you for joining us.
Thank you very much.
That was a really general kind of description about what occupational therapy is. Help us out. Give us a little better idea how this works.
Okay, so in the occupational therapy profession, we are an evidence-based practice in which we are looking at people throughout the lifespan. So from the very young to the very old, and how they participate in their daily activities that they do throughout their life. So that's where the occupation part comes in. And so we see people of all sorts of disabilities, from physical to cognitive. And when we work with somebody, we always start with an individualized treatment evaluation and then move to a treatment plan where we break down those activities to see if that is something that somebody can return to. So if somebody's having trouble getting dressed, is it just a strength issue, or is it something more long-term? Maybe it's tremors or a visual impairment. So sometimes we can modify the task to the person and make them productive in their daily routine again.
And you can do this kind of a therapy in a patient's home.
Yes, absolutely. In fact, the home is the best place for occupational therapy, in my opinion. So what we do when we go into somebody's home is we're able to really fine-tune what is important to them to be productive and safe at home. So when we go in to see somebody, we're looking at their entire environment and their social system and what resources they have at home and how they're able to do that productively and safely as well. So what might be important to you is going to be different to somebody who's 95 or maybe somebody who's younger. And depending on your impairment, if it's something current or if it's something long-standing, we really tailor it to the person.
So is this different than what you might get like at a hospital or a nursing home?
Yes. So when you're in the hospital, we have a main goal of discharge planning and what is the next step for the person at that time, depending on their abilities and disabilities. And then when you go to a rehab, we tend to work on the necessary components like strength and endurance and ability to perform things like dressing and bathing and getting in the bathroom safely. And can they perform a kitchen task safely? And then when they come home to us, we kind of transition them back to what their prior level was, or modify the environment, do caregiver training so that way they can be productive and have a good quality of life at home.
You mentioned a home safety evaluation. What is that? What's involved in that?
So when we go into somebody's home, if I see home safety eval, falls is a huge problem now for 65 and older. It's a leading cause of injury. So we go in and we take a look at the person's environment and how it can be adapted to them. So sometimes it's removing furniture so they can get through a space safely. Sometimes it's adding something like a bar or a commode or a shower chair, or even modifying the task so the person can perform it safely from a walker level, from a cane level, from a wheelchair level.
This is a great time to get outside and work in the garden or do some things. For those who are a little bit older, that is a fall risk, but occupational therapy can help that.
So if somebody came to me or I went to see a patient and they wanted to get out and garden, I would first look at the task and see if it was manageable for the person. So maybe they need to, instead of getting a big garden in the backyard somewhere, maybe we need to do a planter close to the house, and then break that down even into smaller components. So if they have arthritis, maybe some fatter handles or softer handles so they're not statically holding something hard for a long time. If they're a fall risk, there are some wonderful little kneelers that are available that people can kneel on and sit on, so they're not bent over using bad body mechanics for extended periods of time. I would also recommend that they kind of chunk that into 15-minute segments, take a rest break, get up, move around a little bit, give their joints a break. I would also recommend that, big things of mulch and soil, break that up into smaller, more carryable, manageable containers, carts with wheels. There's lots of ways to modify, but that's just a couple.
Megan, you are the best. Megan Keklowitz with Peninsula Home Care. Thank you so much for the time this afternoon. We appreciate talking to you.
All right. Thank you so much. Have a great day.